6:30 in the morning, and the paramedics we're with for the day are responding to their first call. It's from an 83-year-old woman who's in chronic pain.
I feel really sick. I've got a dodgy knee as well.
For Audrey, calling 999 was the quickest way to get help. She doesn't have carers and her son's about to go to work, so Peter and Dan decide to take her to A&E as a precaution.
Let's see you do an ECG, son. You put some of these dots on your chest. Is that all right?
It's a quick handover at 7:30 and the team are back on the road. After attending to another elderly woman and a suspected cardiac arrest, at 12:30 they're called to a deprived part of the city. Peter, what do you know about this one? What?
Possibly having a hypo.
Diabetic hypo. How are we feeling, John?
We meet John, whose blood sugar levels are so low he's at risk of passing out.
You need to admit him, or can he stay here?
Maybe, depends what he's like when he comes round.
John doesn't want to go to hospital, though. He cares for his wife and is desperate to be looked after at home.
You know, these care homes are supposed to be going into one of them. When, I don't know.
Would save you calling out the paramedics, I suppose.
Nobody seems to care anymore.
It's early afternoon when John is finally transferred to hospital, and it's now clear A&E is full.
It's about 2:30 in the afternoon now, and as you can see, the trolleys are beginning to stack up in the corridor. A&E is nearly at capacity already. There's a 4-hour wait to be seen, and the paramedics we're following about to check out again and go out to another incident.
Before we leave, I find Audrey about to be discharged. She told me she had to wait 4.5 hours to be seen.
When you're sitting there waiting, every second counts, and it seems like your turn is really horrible. Sorry.
It's patients like Audrey who are adding to the pressure felt by the paramedics.
We've become much more of a primary care service where we deal a lot in the community, from managing chronic illnesses to mental health illnesses, and in between also taking people into hospital when we can't leave them at home.
It's the last call of the day now, and the paramedics bring Sheila to the Queen Elizabeth with severe breathing difficulties.
I've got no room at the minute for her.
With no bed, Peter and Dan must wait in the corridor at the end of their shift.
Is this something you've just got used to?
Yeah, you do. You sort of get quite used to standing queues for a while.
They'll now have to work overtime, and today was not unique. The government insists long waits are down to increased demand, but until that demand is met with better care in the community, patients will continue to be brought here. Emily Morgan, News at 10 in Newcastle.